Bachorik, and I'm the program director for the Primary Care Training Program here at BUMC. Our Primary Care Training Program offers 3 core additions to categorical training here at BUMC. In addition to the outstanding outpatient training that all residents here at BUMC get, our primary care residents get dedicated clinical and didactic training in outpatient medicine during their primary care blocks. Second, they have access to the tremendous resources of our section of general internal medicine, including a dedicated mentorship program that pairs them with folks with aligned career interests and prepares to launch them into careers as educators, innovators, and advocates for the underserved. And finally, all of this learning happens in a tight-knit community of about 15 residents in our primary care track, offering our residents an additional family within a family here at BUMC. In addition to the 36 weeks that all of our residents spend in clinic as part of our X+Y model, our primary care residents spend 2 weeks of each primary care block in outpatient electives. So what that means is by the time they graduate, our primary care residents have spent 52 weeks of their training in the outpatient setting. For our PGY1s, those 2 elective blocks during their primary care blocks are spent in core immersions, which are exposures to the care of underserved populations, including women's health, geriatrics, correctional health, healthcare for the homeless, and addiction medicine. Once they become PGY2s and PGY3s, they can opt into electives that reflect their particular career interests or growth edges as primary care providers. And they also have the opportunity to add a second continuity clinic where they really build expertise in a niche in primary care. And that niche then becomes both their clinical expertise and a potential foundation for scholarly work as educators, as researchers, as advocates. Boston University Medical Center hosts one of the largest and most productive sections of general internal medicine in the nation, and the resources and community of that section are at the disposal of our primary care residents. So in the spring of their intern year, each resident is paired with a mentor from the section of general internal medicine who is aligned with their career interests or clinical interests. And then with that mentorship, our residents go on to have a diverse set of careers, from public health officials to medical educators to clinical investigators, but they bring to that work the unique perspective of having worked in a safety net institution with our diverse patient population. Our primary care track is composed of 15-ish residents, and that becomes a small family for them within the larger family of the BUMC IM residency. And our residents in primary care learn with each other during primary care block and then spend time together through structured social gatherings like our career nights and our graduation, but also through impromptu social gatherings. And this community also becomes a space for co-teaching and peer mentoring, whether it's through our resident-led morning reports or through informal advice on job searches and starting a career as a primary care doctor. I think it's really special to be part of a community of learners who are really dedicated to providing outstanding outpatient primary care, who are also dedicated to care for the underserved. And I think our residents really demonstrate their commitment to care for the underserved through their advocacy project each year, where they really take on an issue that is timely and affects the patients that we care for here at Boston Medical Center and at the community health centers in which our residents are practicing, and they really attempt to understand it and to identify one small way in which they can make a difference.